There we are.
There we are. What's up, Charles?
Nothing much, brother.
All right. All
Just feeling
right.
kind of, just feeling kind of under the weather. That's about it.
Working too hard, man. You're working too hard, bro. Gotta
You
take
know,
it easy. Gotta take it easy, man. I've been super exhausted lately. I think maybe the like you said, Charlie, maybe it's the heat.
yeah,
Um,
I think so.
okay, now I'm trying to figure out. Okay, here now my comments are running. Okay, I always gotta shrink my video and then open them up again. And then I can see the comments. All right, everybody, aloha. Welcome to Hump Day Wednesday. Special show tonight. Mayor Kawakami and Dr. Berreman will be on at 7 to talk story, share with us some updates on what's going on as we enter into or we start to opening up of our state. So we'll see what they have to say. And what's your thoughts, Charles? What's your thoughts? Did you see the Lieutenant Governor's interview this morning with the Star Advertiser? It was on Facebook. I shared it on my page.
Well, honestly, brother, I have just been so preoccupied. I should, but from all the comments I've been reading on Facebook regarding, and I wanted to tell you that a special person that came and helped us. She is a sales manager over at KBR, Kauai Beach Resort. Her name is Lisa Nakamatsu.
Oh, yeah.
She gives her very best to you. She's been so kind to the new company that I work for, and they've been really accommodating because as I brought it up to you, I have just a limited amount of days to train over 122 employees within a given specific amount of time and the requirements that they have to undergo. And it's a Mount Everest to climb, put it that way. It's a mount it's a Mount Everest to climb. And she's on right now, Lisa Nakamatsu.
Yeah,
So anyway,
she's
she
amazing.
said
She's an
some
amazing.
very yeah, she said some very wonderful comments. And I was tickled, and I just wanted to let you know she sends her best to you, Mel.
Well,
And
she's a dear friend. She's an amazing worker. She's an amazing person, amazing human being, and I'm glad that she's on. I my comments aren't working right for some reason, so I miss a lot of the comments, and I apologize if I'm not responding to your comments or your questions. I know that there'll be a lot of questions tonight. I'm hoping that Sarah Blaine will be on. She usually is the
yeah,
mayor's chief of staff, so she can answer a lot of the questions that are directed to the mayor. I definitely have some questions for Dr. Berreman as well. We know that the Delta virus has landed in Hawaii. I think we're up to 2 cases now. We don't know. We'll find out tonight, but I don't know if any of them are on Kauai. But I do have some questions because as I have been watching around the country, different doctors, experts, Dr. Fauci today expressed his grave concern over the Delta virus because, according to Dr. Fauci, I know a lot of you don't think he's worthy. I do. I trust Dr. Fauci's medical expertise. And he said we should be concerned because it is definitely much more contagious, much more easy to spread, and from what they're seeing, causes more serious illness to those that get infected with this variant. That was right out of Fauci's mouth today. But this morning, and I don't want to sound like I'm always picking on the lieutenant governor, but his interview this morning, the reporter Yanji asked him straight up, "Do you have any concerns of the Delta virus that has made its way to Hawaii?" And he said, "No, not at all." That he has no concern. In fact, he's pushing the governor to open up now. He thinks everything should open up now, right now. That we shouldn't have to wait because the hospitalizations are so low. And tonight's news, we find out that there's I guess the federal government gave the state over $100 million for testing, for surveillance testing, and that we're not testing anymore because no one needs a test inter-island travel. So no one's getting tested. And Scott Miskovich was on the news and he said that's very dangerous because 50 to 60% of the patients are walking around asymptomatic, carrying the virus and spreading the virus. And without testing, we'll never be able to identify it. This is the first time I heard Dr. Miskovich say that the numbers that we are seeing out of the state is really not an accurate picture of the amount of virus in our state. First time, Charlie. First time I've heard. I mean, we've talked about this offline with Dr. Miskovich. He's never said it publicly, not that I know of. But today, tonight's news, he made it very clear that because of the lack of testing, in fact, the numbers that we are seeing of positive cases is not an accurate picture for our state. So does that bring concern? It should, but according to our LG, he's not concerned about the variant or any of the variants. He said we're going to have variants. We just got to deal with it. Interesting. If you haven't seen it, watch tonight's news. Or I'm sorry, go to my page, watch the interview. It's not very long. I posted it on my page. You can watch the video, the interview in its entirety. Very, very telling. But again, it's the same message that, you know, it's the race to get to 70 so we can open up. He wants to open up now. He doesn't want to wait. Interesting.
You know, it's almost like I'm just trying to get a grasp on the thought process that he has. I mean, it would be nice if he could share it with us instead of just making a blanketed statement, right? Because anybody can make a blanket statement right now. But to come out and really not give his basis why, I mean, just because we have low number counts of COVID cases in the hospitals, I mean, I would like to say, I beg to differ, because you both you and I have sources, and it's frightening that the numbers we get is somewhat different. But you know, it's telling. It's telling, and I think that's the reason why we feel the way we feel.
Yeah.
You know, and it's quite clear that he's being directed. And you know, it would be nice if he said that per Dr. Libby Char, per Dr. Sarah Kemble, and this is the reason why. Then why does his own state lab director have concerns? Or is it that that's just the individual's demeanor when he's on the news? He looks concerned when he's not concerned. Concerned when he makes a statement and they make it like, he is not concerned. Don't worry. And
Charlie, I gotta make you a co-host because it's telling me my internet is not stable.
Yeah.
I'm not sure why. I'm hardwired in. The thing is showing that I have 100% power, so I don't know. But anyway, so if I disappear, just keep on going, bro. I don't know what's going on.
Okay. Well, we have the mayor, but right. Anyway, my closing statement is he made a statement. He is the lieutenant governor. But I'm starting to realize that just because you're the lieutenant governor, it's like some people might say, just because you Charlie on or what you say doesn't mean it's that way. You're right. But you're never going to hear me say anything that will mislead you. That's what I'm trying to say. I'm not in the business of misleading anybody. I'm just going to take it for what it's worth. Have a good night. And that's it. But I'm not in the business of misleading anybody. And I think based on the comments we see, a lot of people feel misled because he's continually saying what he says. And yet all the noted experts that we've had and continue to hear on MSNBC, and maybe we got to see if there's a conspiracy that those noted experts are really not telling us the truth or whatever. But
we shall see. All right, well, let's bring in the mayor here.
yes, there he is.
What's up, mayor? How are you, bro?
Oh, I'm good, thank you.
There he is.
Looking good, man. Looking good. You look, I don't know, you look refreshed, like you ready to roll, man. Like you're ready to jump in the water and take on a big wave or something.
Big of a wave.
How's everything going? I see Dr. Berreman just jumped on. How's everything going, Mayor?
You know, I think the island is in a good place. I know that we're going to get the ups and downs with cases, and we're always concerned about them because we do know that there are, you know, still a large amount of people that haven't received the vaccine or, quite frankly, are hesitant to get one. But, you know, especially for children, I know that, you know, people think, you know, the kids get sick, they recover well. But, you know, I still don't know enough about the virus. I mean, I just, in general, I don't want my kids to get sick with even the common cold. So we're always concerned because you still have those little keiki that just, you know, they are, you know, potentially, you know, they don't have the protection that I have received and my wife have received with the vaccine. So, well, hi, Dr. B.
You know, Maris, one of the things I think that really we all, I think I speak for all of our viewers and Charlie, that respect you, your team, especially you and Dr. Berreman for always being straight, always being putting health and safety first. And that's very evident. And I think it's clear by the comments that everyone. So thank you guys for just being real. We appreciate that. And thank you for joining us tonight. We always appreciate when both of you at the same time can be on our show for an hour or so. Thank you.
Thank you for having us. Sorry, I was a couple minutes late.
Oh, you were fine. We just was.
Don't you worry, Dr. Berreman. We have your tardy pass standing by.
Thank you.
Melissa Bolton says, I love Dr. B so much. She's so pono. I don't know if you guys can see the comments, but if you can't see it now, make sure you go back after the show and watch it. But anyway, again, thanks for joining us. I don't even know where to start. I just want to turn it over to the both of you. Give us a real quick overview, where we at, where we're heading, and then we'll have some questions. So, Mayor?
Ladies first.
Oh.
Well, I wonder which one of us that would be. Well, I heard, sorry, I did come in a little late. I heard the mayor talking about children and how they can be protected. And I do think I've had a lot of parents ask me, you know, with a great deal of anxiety and concern, when are we going to be able to vaccinate our younger children younger than 12, especially because of going back to in-person learning and families wanting to travel and all of that. But some of the parents who've asked me that question have not yet themselves been vaccinated. And so I think it's important for parents to understand, and grandparents and aunties and uncles, all of us, that the strongest and best way we can protect our children right now is for everybody around those children who is old enough to be eligible to be vaccinated, because children are actually most likely to be infected by somebody else in their household who brings COVID-19 home. As I think we talked about earlier when we had some exposures related to schools, we didn't see any transmission related to those school things. And that's not where we're seeing children getting sick. We're seeing children getting sick at home from other adults in their household. So if you're worried about your kids, get vaccinated yourself and make sure the other adults do. That said,
let me just stop you real quick because we forgot to do this. Charlie, you slacking, Charlie. We got to do this station identification.
There's the reason why I'm slacking, but okay, here you go.
Okay, guys, hit the share button right now. Okay, thank you. Sorry about that.
No, that's okay. That said, Kauai is still doing really well in terms of vaccinating and in terms of cases. And I share your comments that it's a pleasure to work with the mayor, and I really applaud him for the way that he has been able to balance health and safety concerns with all of the other concerns in our community. And I know that those decisions have weighed very heavily on you, Mayor, and I really appreciate the partnership that we've been able to have in managing through the last year.
Oh, we're gonna just pour the compliments on each other for the first 15. No, you know, the only reason why we can get through this and be steadfast and just is because we have a great team. And you know, we're lucky we have a great district health office under the leadership of Dr. B. But most importantly, I do want to remind everybody that I believe what separates us from the rest of everywhere else, anywhere USA and anywhere else in the world, is just our people, right? And it's evident based on some of the clusters that we saw earlier, and people coming out to say, hey, look, I tested positive. If you folks are around me, I care about you, please go get a test. We've had businesses who said, look, the businesses did the right thing. People have been doing the right thing. And they've been just doing what KOI does best, and that's care for one another. You know, we may not always agree, but when push comes to shove, if somebody needs help, not too many people would just drive by or walk by the person. They'll stop to, you know, pick the person up and see what kind of help they can provide. So that's the bottom line. It's our people.
Let me ask a question to both of you, and either one of you can answer this. But given what we are going through now with the wide open travel for the inter-island, and soon I'm pretty sure soon it will be trans-Pacific travel. Because everything will be sort of like blind, you know, we won't know until somebody gets really sick, right? And show up at a hospital or show up for some kind of medical intervention. So prior to that, we don't know if there's anything in the state, correct?
I don't think that's entirely the case, Charlie. I mean, the county continues to support free testing in our community for anybody who wants to come Monday through Friday at the convention hall. And that's not just residents, that's visitors and residents. And we see a steady stream of people coming in to get tested because they've traveled, because they're worried about some place that they were. We see some businesses requiring that people get tested after they've traveled before they can come in and frequent the business. We see visitors being tested there. So, you know, yes, there are going to be some people who will try to fly under the radar, and we see that now, but there are an awful lot of people who want to do the right thing. And testing is so easily available. I mean, at the convention hall, there's usually no wait. You're in and out in 15 minutes. You get your results within a couple of hours. And every time we have an uptick in cases, we also see an uptick in people going to get tested. So our community is really paying attention. And I think that that will continue. If anything, I expect there'll be more testing as we have more travel and because people understand that that's a risk.
What kind of percentages are we looking at as far as people coming into test? Is it, I know when we had that spike, there was a huge concern in the lines are long, but it's no longer the case. And when you say steady, how much are we looking at a day of testing?
We're generally seeing between around 50 to 75 a day. When we have a cluster or have a concern about something, we may see up to 100 or a little more than that a day. So we're not seeing anywhere near a substantial percentage of that's in the free testing center. Now we know that people staying at resorts are using, there are lots of private avenues that people are using too. I actually don't have the total testing numbers off the top of my head, but they are on the website, the data website.
I know on the news tonight, there was a story about the funding, the federal monies that came to our state, over $100 million for testing, and that in fact, the state is right now, it's the lowest, today was the lowest day, or whatever the last reporting day was yesterday, or today was the lowest testing count in our state since the new year, or New Year's Day or New Year's Eve, whenever it was, and that in fact, they don't expect the numbers of testing to increase simply because the inter-island travel now, no one's requiring a test. I'm hearing what you're saying, that some people are still going and getting some testing, but sounds like statewide, the demand for testing has dropped tremendously, and that in fact we're not putting out the test. They don't even know how much, all the money that's remaining, they don't know if they're going to be able to spend it on testing because of the demand. Have you seen anything like that?
Well, we have to think about why we're testing. And we want to test in order to identify disease. So in addition to looking at how many tests we're doing every day, we want to look at the percentage of those that are positive. And so our rates of disease have been very low statewide, and the percent of the people that we're testing who test positive has also been very low. So there's not an indication that we're not doing enough testing for our current situation. The first indication that we need to be doing more testing would be to see a rise in that percent that's positive. That would tell us, oh, there's more disease circulating than there was a week ago or a month ago, and we should have an uptick in our testing. And again, I think that we would have that because people would see that the cases were rising and there would be more concern. So it is a balancing system. There's not a right number of tests to do every day all the time. It depends on what's going on in our community with the disease rates.
So I guess in the process before we go into a complete lift of this, the testing of trans-Pacific travelers, when the safe travel is in place or was in place, but no longer in place for inter-island travel, it seemed like that was sort of like the protective shield around this entire state. And because it's no longer there, how do we address those states that sort of is seen like a little uptick that may be a little concerning to some, but not as great as it was in the beginning stages of this pandemic, but yet nevertheless, it's starting to take a slight climb. Is that concerning, especially if we're talking about travelers coming into the state of Hawaii?
Well, so the Safe Travels program for travel from the mainland is still very much in place. And the threshold for lifting that is that 70% of our statewide population is fully vaccinated. And we're not there yet. So the safeguard against high rates of disease elsewhere is that we will have a much more highly vaccinated population when we take that step of lifting the Safe Travels program. When the governor takes the step of lifting that, that's the threshold that he's set.
The Delta virus has brought some concern to many of the medical experts that I'm listening to on the news and on TV and on YouTube. I know Dr. Fauci came out and said today that we should be concerned about the Delta virus because it is being shown to be much more contagious. And actually, they're finding now, based on the people that have contracted the Delta virus, that it actually creates a more severe illness or more serious illness than the normal strain. Is there any concern on you? I know I heard the Lieutenant Governor today on a Star Advertiser interview, and he said he had no concern of Delta, that it was just another variant that we will manage. But is that the sense of the Department of Health that we shouldn't be concerned about Delta, or we should be concerned? That's a big one for me, the Delta.
Yeah, no, it's a big one for me too, Mel. I appreciate your bringing it up. I didn't have benefit of listening to either of those news broadcasts today, so I don't know what Dr. Fauci or the Lieutenant Governor said, so you can hear what Dr. Berreman thinks. Certainly, there's reason to be concerned about the Delta variant, and the reasons are that one, that it's clearly much more transmissible than other strains. It's even more transmissible than the other variants. And that means that in places where it's been introduced, like India and then more recently the United Kingdom, it has very rapidly taken over and become the dominant strain. So we should expect that it will do that on the mainland and eventually here on Hawaii. So that's concerning. We know that this is the main COVID we can expect that this is the main COVID we will be dealing with in the future. And then there is the suggestion, I'm not sure how strong the evidence is yet, but there's certainly a suggestion, as you said, Dr. Fauci said, that the disease that it causes is more severe, that if you get the Delta variant, you are more likely to be hospitalized with it. But the other thing that we know about it that balances those concerns is we also know that our vaccines work really, really well to protect people from all of the variants, including the Delta variant. So if people are concerned about it, as I think it's appropriate to be, the single most important thing you can do is get vaccinated. And it's very important to be fully vaccinated, because with the 2-dose vaccines, 1 dose doesn't protect you nearly as well as 2 doses for the variants. But people who've been vaccinated, even if they get the Delta variant, are very unlikely to have severe disease, very unlikely to be hospitalized, and very unlikely to spread that disease to other people. So it's really good news that the vaccines still work. I frankly would be much more worried, and I think everyone else would be too, if there were an indication that the vaccines were not effective.
And I think it goes to it really reinforces the push for getting vaccinated, because the more people we get vaccinated, obviously reduces the risk of the Delta. I appreciate that. I mean, you clarified. Basically, you said exactly what Dr. Fauci said today, the similar concerns. Thank you.
He's a smart man.
I agree.
Mayor, with regards to businesses and the books that you took on the beginning steps leading up to where we are now, it seems that the businesses are more appreciative that certain actions were taken, and it kind of proved itself in the end, especially with the comments you've been receiving of support. I mean, how great are the comments? You know, how big is it? Is it across the entire county that you've been hearing from businesses that the right decision was made, even though it was painful, but it had to be done? And now that you've opened up, how have the comments been?
That's a good question. I mean, to be honest, you know, I took a break from social media just because at one point it just wasn't adding value to my personal life, right? Because it's a double-edged sword. It can be a rather toxic environment, and you know, I know the businesses took it hard, but even during some of the tougher times, we've had a number of businesses that were impacted that, you know, couldn't vocally come out to support it because you know, there was a lot of emotion tied to some of our decisions, but they were thankful, right? Everybody has different priorities, and they take a look at health in different ways. Some people really spend time to take care of their health, and it's a very top priority in their way of life. And some people are motivated by other factors, and so it varied. But I think now that we're seeing a return of the economy, I mean, it's roaring back. Now the challenge is finding workers. I think a lot of people and businesses have been appreciative, and many people have reached out to say we get it, you know. And it's hard because I think when we do what we call our hot wash on the whole situation, where we break down our operation and look at where we were strong, where we need to improve, I think one of the things that was a big challenge is things were happening so quickly that it was hard to communicate what the big game plan was. And it was really convoluted at times, because you would have the lieutenant governor saying one thing and Dr. Fauci saying one thing, and then I'm saying one thing, and then you got the president, you know, saying one thing, and people are getting confused. But really, what we broke it down to quite simply is we're in a race to get as much people vaccinated as possible before we get to a good level of confidence that we can have the wherewithal to see the disease come into our island. So we really wanted to make the vaccines available for our elderly population, for people with underlying health conditions. When you break it down demographically, of course, it affects our Native Hawaiians, it affects our minority groups, it affects all of the minority groups that have high, you know, diabetes rates, high obesity rates, high blood pressure, heart disease, lung disease. That's our people, right? That is our melting pot. When you take a look at it, it's our minority groups. And so we wanted to take care of that. We wanted to take care of the industry workers that were going to have high contact, like the visitor industry workers, the restaurant workers, everybody that has to deal with customer service and are forward facing to the public. And we feel that we had achieved that. And I think that we saw some evidence of that sort of fruits of our labor and all the sacrifices that everybody made, but especially the businesses, when we started to see the big uptick in cases. And we got one eye on the number of positive cases, but we also have our finger on the pulse and our eye on what the hospitals are telling us as far as people coming in to get hospitalized or people coming in that need to be put on ventilators. And the situation has changed. There is treatment that is available through the hospitals that quite frankly wasn't available. And I think because we were able to get a head start on our vaccine strategy, I think a lot of the businesses now realize that one, we're in a better position to have the economy roar back without having too many people get really, really, really sick. And two, there is a level of safety within the employees that have become vaccinated, that there's a higher level of confidence that they feel safer returning to work. And so I think some of the businesses see that. I know that I'm going to have to work hard to sort of make things good again with some of the businesses that were really upset with me. And they just have to understand that myself, coming from a business family, it was the one thing that kept me up at night, was making these decisions and understanding that we were hurting the very backbone of our economy, which is our mom and pops, right? That is the fabric of our society. That is Main Street USA, which is what we're concerned about, versus Wall Street USA. It's our Main Street businesses.
Well, I will say that I hope those businesses that were hard understands that this pandemic wasn't a one fits all, one size fits all. I mean, that would have been the magic pill, right? If one size fits all, everybody can, one time it affects, or it doesn't affect everybody, but it just doesn't work. What might be beneficial to some might be a total disadvantage to others. And you just have to make the best call on it. But I'm glad you mentioned what you said there, because even for us, from viewing from the outside looking in, we could see how it created this tension, and yet it kind of left me dumbfounded, like, how if you're gonna make this side work, yet we know the drawback is this side is gonna have to suffer a little, right? And so it was constantly this ping pong effect going back and forth. But I'm glad the best came out of it, if you want to call it that. And
that is like why right off the bat, like from day one, and Dr. Berreman has been, literally, we've been attached at the hip from day one. But as soon as we started making these calls, we got our Office of Economic Development fully activated and engaged as part of our incident management team to start creating the Kauai Economic Recovery Strategy Team, which partnered up with the Kauai Visitors Bureau with Sue Kanoho, with Mark Periolo and his team at the Chamber of Commerce, to be able to see, if anything, what we could do to provide short-term relief and triage the economic downturn. And then, of course, start creating the long-term strategies to be able to buffer ourselves so we don't get hit as hard the next time around, and we can learn from this. And, it was a worldwide economic disaster, and it was unfortunate, but it happened, and we did our very best, and we continue to try our very best. We're going like 110%.
Yeah, Charlie and I both got a lot of negative feedback on social media from, our open support of how you were handling it, and we still support you today. Yeah, some people, really upset, and as recent as last week, I got somebody still cannot stop. He cannot let it go. But whatever. I hope he's watching tonight. I kind of wanted to get to Dr. Berreman, the 70%, the goalpost or the goal line is the 70% number. I see a lot of questions coming up. I don't know the answer to this, and I'm not sure if you do, but have we vaccinated visitors here in Hawaii, and is that number being counted towards the 70%?
Yeah, we're focusing on vaccinating residents, and that's what we're looking at the 70% of. Is it possible that a visitor has posed in some way that made people think they were a resident? I'm sure that some visitors have been vaccinated. We do, of course, on Kauai have people who spend many weeks or even months of the year here, and we certainly do want to vaccinate those people because they are part of our community for the time that they're here and pose risk to our community in the same way as year-round residents. But we're really focused on vaccinating residents, and that's true statewide, precisely because, as you say, if we vaccinated a bunch of visitors and added those in, it would inflate how well we were doing in our vaccination.
Yeah, and I know there's some disparity, the CDC numbers and the state numbers. I don't want to really get into that right now because the governor has already made it clear that he's utilizing the state data for that 70% goal line, and that's it. It is what it is.
Even the CDC has said publicly that their numbers are wrong and that the state numbers are better. So, yeah.
So I don't have a problem with that. I had this discussion with someone the other day, and I said, even if we had the number of true visitors that may have been vaccinated is so small, I do not think it would create a huge impact or a change in the number of the 70%. Maybe 70.1 versus a 69.9% maybe. But the other question is, I know the governor talked about if we couldn't get to the 70% for whatever reason, that they had a plan B, they had backup plans. I know the lieutenant governor today on his interview said that he's pushing the governor to count people that have already had COVID, people that already have had COVID, and take them out of the equation. We know that you can catch COVID again. I mean, we've seen those cases, maybe not very common. But what is your feeling? At 70%, do you, Dr. Berreman, believe that it's safe enough to just open up? Knowing that Hawaii has, 30, 40,000 new people coming in every day from the mainland. Are you comfortable with the 70% number?
Well, so, ideally we would shoot for herd immunity before we did that. And we don't know what that number is, but it's very likely to be higher than 70%. It's more likely to be on the order of 80 or even 85%, especially when we look at the increase in variants and the Delta variant in particular. But, from a health perspective, we also have to look at the impacts of economic challenges. And we know that there are real health impacts from being unemployed, from not having an income, from having unstable housing, from not having a secure food source, all of that. So, and there are also mental health impacts of the pandemic. So I think that the decision that the governor reached to use 70% of our entire population fully vaccinated as a threshold for lifting safe travels, I think it's prudent. It's not without risk. It certainly has risk, and that's why the health department will continue investing in testing and monitoring and surveillance and disease control with quarantine and isolation and contact tracing and all those things that we do. And we expect that we'll see an increase in cases. The hope is, and I think it's a reasonable hope, is that at that level, we will be able to continue to contain disease and won't overwhelm our hospitals and see deaths that would have been preventable. Again, because as the mayor said, we have done extremely well in vaccinating our highest risk individuals who are our kupuna. So I support the decision. It's not a risk-free decision, but almost no decision is.
Thank you.
Mayor, we saw this phenomenon happening with, and Dr. Berreman just mentioned it, that, a lot of times the social impact this pandemic had, unemployment. And yet the unemployment program took off with all these aid from every angle possible. it drove the unemployment not wanting to come back to work, right? So that's what make it hard, and it almost seems as if when a second rounds of influx of infusion of more cash, it got to the point that those who were receiving the benefits just rolled the dice and said, "Hey, I think I can stay a little bit longer." What's your comment or what's your take on this? I mean, it kind of, like you said, it's like a two-edged sword. It was great to help one way, but when a slice came back the other way, it really crippled. I mean, a lot of businesses. I, for one, in the security business, we had people, and in our business, you got to be licensed, and just to get that to the front line is tough. But now people are not even answering the call. So, how do you feel about that with all these benefits that's going on there?
Well, I think definitely at a certain point, it was very much needed and very much warranted. And even on a normal day to day, there are families and individuals out there that truly need that unemployment just because they've fallen on hard times. However, I've always been a proponent that giving people a helping hand is the best approach. And it's because it's important in life for people to understand that they have a role to play in society, that they are a part of something bigger, and that it gives them a sense of purpose, and it gives them, a sense of accomplishment. I've always been a firm believer that people do best when they feel that they're a part of something. And that's really why we had created that Rise to Work program. And, we were playing with the idea of Rise to Work even before the pandemic. It was really targeted to working with the nonprofit agencies that work with our houseless community to be able to identify the segment of population that, hey, they want to get back to work. They just need a chance. They just, they just need a good break their way, and they need a helping hand. And, and that's why we had partnered with the first phase with nonprofit organizations that had a tremendous amount of work that needed to be done. We created a partnership to help fund those organizations to go and hire people off the bench, because there's a lot of people that didn't want to stay at home, right? They didn't want to just, to take the free money, and those people got back to work. And it created some long-lasting relationships. Many of those workers are going to be permanent hires. And then, of course, with the generosity of, Priscilla Chan and Mark Zuckerberg, they kept the program running, where we were able to now expand it to businesses to be able to give people that helping hand, get them off the bench, get them back into work. And so I've always been a firm believer that, government should start looking at creating these type of programs where we help people out, we get them work, we get them the medical insurance that they need, we give them the skills, we give them a break, and we get them back into productivity, because being productive is so very important in society. And most people do have a yearning to be a part of something bigger, and most people do want to have that sense of purpose. And so that's my whole feeling on the unemployment system as a whole, that it needs to be worked on, and it needs to be, some resources need to be shifted towards partnering up and creating public-private partnerships, much as what we did with the Rise to Work program.
Now, do you agree with the steps taken by the governor to, I guess, accountability, right? Because for the period of time in the beginning, people were just getting the benefits. There was no accountability to find out whether or not they were actually looking for jobs. Now, before you can receive your benefits, you have to go and you have to track, and you have to kind of prove that, you spoke to somebody and in fact, they didn't have work for you, or you weren't qualified for a certain position, whatever the case may be. Do you believe that those kind of checks and balances needs to be in place moving forward?
Absolutely. Absolutely. I think it's something that we've heard loud and clear from the business community. many of them, like what we spoke about, that they get it now, right? Like, you know, we've had business people come up and say, you know, I was totally 100% against everything you guys did, but I sort of see the big picture. But now my biggest problem is how in the heck do I get my workers to come back to work? And so there always needs to be a level of accountability and checks and balances. And I do think that at this point in our operation and where we are as a state, and seeing the economy return, that it is the right time and the right place to start having those checks and balances restored.
Mhm. Okay.
You know what? I saw a post the other day. The $300 extra a week that everybody got for not working should have been given to those that were working or that are working, and then all of those people that aren't working are going to go look for work so they can get that extra $300 a week. I thought that was cute. I obviously early on, all of those funds were required, but now as the jobs are opening up, this my next question is really, and I'm not sure who can answer, probably you, Mayor, but Dr. Berreman, I know you guys have discussions with the state and all of the mayors and so forth. Where are we on this return? I know I've heard several news reports talk about many industries are back to pre-COVID status. I've actually saw different news reports that talked about we've surpassed some businesses have surpassed the business that they had pre-COVID. Does anyone know where we're at statewide? Are we at 60, 70, 80% of pre-COVID business? Does anyone know that?
You know, Mel, it's hard to put my finger on it. I do know that based on the arrivals in general, we're at or exceeding pre-pandemic levels as far as domestic arrivals, right? Like, I think the whole country and the whole world has sort of like that caged animal syndrome, where as soon as they can travel, they're jumping on a plane. And I think, you know, a lot of them are making Hawaii their destination. And, you know, Kauai in and of itself has sort of created a brand through this pandemic that we take safety and health as a top priority. And let's face it, when you and I travel, we want to be able to relax. And it's hard to relax if you're traveling to a destination where you don't feel the comfort that the area is safe. And so based on that number, it looks like, you know, we're on par. And then you're going to get the economic experts that'll say that their forecasts say that, hey, it's going to be a bigger return than expected. I know the governor has said that he's worried that this is a bubble that could burst. I am also very concerned about that. But I can speak on just our personal experience going through downturns in the economy when we did own Big Save, is that even though businesses get the foot traffic and the customer count back, it's going to take a while to catch up, just because many of them may be back as far as paying rent to their landlord. Many of them have had to put off necessary repairs and maintenance that now they got to get caught up on. And so that sort of butterfly effect where, you know, it's going to ripple for a while. I can tell you that, you know, Big Save never really hit our numbers that we were hitting pre-Hurricane Iniki. You know, it took that long to even get close, and we never got to the level that we were at as far as profitability, you know, decades after the hurricane. And so many businesses, it's going to take them a while. But as we speak today, if you want a snapshot of where we're at today, it looks good. It looks good, and if we can trend in that direction, we'll have a solid economic recovery that we can sort of rebuild that foundation on.
Yeah, and that's why sometimes I wonder, you know, okay, so we're on track right now, even with required testing, or you know, if for those that don't test, they get the quarantine or whatever. That, you know, so when we open up, you know, more people are going to come, and can the infrastructure handle the additional burden? Businesses that are having a hard time getting employees, I mean, that's not going to go away anytime soon. So that's a concern that right now we're having a hard time managing the number. And so I just a little concerned about that.
Let me ask a question real quickly. and this is kind of a shift, and this goes towards Dr. Berreman. You know, it's I guess when Maui started to experience their clusters in a place of worship, uh, I guess they took the position, and you know, there was some negative feedback about that. Now with the clusters or reported clusters here on island is and supposedly it's a place of worship. I'm just reading some of the comments. You know, why isn't that being mentioned? Where is it? Is it a position from the Department of Health that
Yeah.
maybe more damage than good, or
Well, so I'm glad you asked, Charlie, because it is a common concern, and of course we did name the locations of a couple of clusters at restaurants a month or two ago. But a restaurant is different from a place of worship, because at a place of worship, usually the members of that place, the parishioners, the congregation, it's known who those people are. And as long as the organization is collaborative and cooperative with the Department of Health and will help us in communicating with people who were there, letting them know that they've been exposed, letting them know that they should be tested and all of that, then there's no need for us to go public. And we don't publicize, you know, who has disease or where it is, unless there's a real need to do that, because we want to protect people's confidentiality. And this is a virus. It's not anyone's fault that you have it. It's not, you know, it's not a judgment on anyone. So if we were to have a cluster at a place of worship and the organization said, no, we don't want to talk to you and we won't tell you who our parishioners are, then absolutely we would need to name that location and the days and times in which exposures might have taken place. But when we have good cooperation and the organization is comfortable that they know who their congregation is, then we just work with them that way. And the people who need to know are able to be informed. And that's the situation in the current cluster that we have.
Yeah, and you know, I wanna add to it from a non-health expert sort of perspective that you know it's common. This is not anything new, and I just draw in my experience from the food service industry that they have a number of product recalls that happen all the time with food that may have been tainted. Where you know, if one they can identify the batch of product that needs to be recalled, and they can trace the organization and get it off the shelves, they are effectively containing it and containing any outbreak of potential illness, foodborne disease, and so on and so forth. They don't name the business, but once the product has hit the shelves and it's you know being sold, they will go out and name businesses. And it might not necessarily come from the local district health office, but it'll come from manufacturers that are required to disclose. You know, the business will have to disclose that if you bought this product from this date to this date, and if it has, you know, even like the serial number with this, you know, it may be potentially tainted. And they will name businesses out there all in the name of public health. And it all just drills back to how effectively can our community contain outbreaks of disease. And if it can be done effectively, discreetly, it will. But if it gets to a point where we're concerned about the general public health and safety and the containment is not effective, then of course they're going to have to disclose locations. But I can tell you that the Department of Health does everything in their power not to get to a point where they have to disclose, because they are very aware of how devastating it can be, you know, to businesses and to people as well. It's like their last resort.
Yeah, and I appreciate that, Mayor. That's absolutely the way we approach it. And it's also the case that if we were to make a public announcement about every place where there's a case, that could potentially discourage people from being tested or from coming forward when they're sick. And we do want people to get tested, and we do want people to get care when they're sick. So again, it's protecting privacy and confidentiality. It's also protecting our ability to work effectively in the community and with the partners that we rely on to do this work.
I'm just surprised that the church or the place of worship wouldn't come forward and disclose that they had a cluster. I know we've seen that in the restaurant industry, and I understand they're saying they know every parishioner, but even the church that I go to, every single Sunday, there's people that aren't regular parishioners that show up. They may be church hunting, they may be visiting, they may be, you know, just experimenting with different churches that you know, that the church may not know who they are. But I mean, I guess like how if I got COVID, I can promise you I would come on Facebook and let everybody know, hey, I tested positive. Anyone that came in contact with me over the last few weeks, just letting you guys know. I'm surprised whether it's a place of worship or any business, that because it is a virus and it's no one's fault, why wouldn't they come forward and just, you know, do a little public statement saying, hey, you know, just to let everyone know, anyone that's come in our business, whether it's a place of worship or a church, I mean, a restaurant, you may want to consider getting tested. We did have a little cluster in our place. I would expect that from businesses. I really would. That's just my personal opinion. I mean, I don't think I would, if my church came out and did that, it wouldn't stop me from going back to that church. It definitely wouldn't stop me from going back to church. But
I would say that in the situation of the restaurants that we had here, those announcements were made by the Department of Health before the restaurants came forward. But what the restaurants did was cooperate with us and be extremely helpful in terms of contacting all of their staff. And they also were very interested in and did have vaccine clinics available on their sites afterwards, after all the quarantine and isolation was done, in order to offer vaccine to any employees who weren't yet vaccinated and to the people who frequent the business. So I think we do have a very community-minded community, and that's certainly an opportunity to vaccinate on site at the places of worship that we will always offer once we're finished with the acute phase of people being sick and quarantined.
Well, you know, please forgive me for what I'm about to say. I guess what I hear then is if some place doesn't cooperate, then you put the squeeze on them. That's what it sounds like. And maybe I'm that's the way I've seen it. And I know I'm going to get back to saying
we don't say it quite like that, Charlie, because we don't find that threats are very useful. But
right.
But what we do say, and I think it's true, is that, you know, your congregation and your parishioners or your guests, if it was your baby luau or your social event or something, they would rather hear from you than hear from us. So so we would like you to work with us to do the right thing for all these people that you care about and have some level of responsibility for. And, you know, I think that kind of collegial and we're in this together approach is much more effective than the threatening approach.
Yeah, it's a little sort of like the lesson the mom gives you, that, you know, when your mom is putting not the squeeze on you, but when she's trying to get information from their kid, they're like, son, an ounce of honesty up front will save you a ton of heartbreak down the road. So, you know, it's one of those things where, you know, as a business establishment, you know, especially, you know, food service, retail, everything else, it's like people make decisions on, you know, how safe they feel, right? That's why if you go to a restaurant and it's clean, you tend to feel safer. But in this case, businesses and, you know, if events are happening, it's always best to come from the business because it shows that they care about their customers, right? It's not a good look if you're not cooperating with taking care of your customers' health. So, you know, that's why most of them, without even having to have been asked, right, will come out and try to do the right thing. And I think that's just, you know, it's something that I'm very proud of about Kauai, is that, you know, it's a community that truly cares about people, and they're not driven by just, you know, making a dollar off of someone. There's a sense of community that exists that really helped us to get through some tough times.
You know, one last thing I would like to say, you know, I myself am fully vaccinated, and I don't know why. It's just I just still have concerns, and I don't know if I'm not listening to the right information that's coming out, because, you know, when you read about those who have been vaccinated, who is slightly under the weather, that's gotten hit by the variant, I'm still at a point that even though I'm happy I'm vaccinated, I just don't know why I feel the way like I still feel in a slight unsafe that, anything's possible. And I think that's the thing that concerns me. And I'm pretty sure there's many out there because, trying to wrap your head around this subject matter, I understand that the vaccine lessens the severity of it, right? When you get it. But I think the way it was promoted by some of the noted experts who are here locally and, saying that, once you're immune, you're immune. I think, that caught on like wildfire. And so everybody was, yeah, we get the vaccination, we're immune. But, it really doesn't work that way. Am I that small percentage that feels I still don't feel quite safe yet? Or
I think, in general, it's just the fact that this is like the flu vaccine, right? You can get the flu vaccine and still get the flu and it still sucks. It's not fun, right? Just being congested is horrible. And this is sort of, with the COVID-19 vaccine, it's very effective against the disease, but you could still get what they say is mild symptoms. And if you're anything like me, mild symptoms are still not fun, right? And the fact is we're still learning about the virus, about the long lasting effects. And I just know that I feel a lot safer now that I'm fully vaccinated. I can tell you, you could ask our team, at the beginning, I wouldn't eat vegetable. I don't eat vegetables anyway, but I would use the excuse that, hey, I'm not eating anything raw. And, I like that went with like poke. And it was just me, right? Like I was just really concerned. But as soon as I got my vaccine, the poke and everything else, I just, and I know that we know a lot more about the virus now that, it's not necessarily spread or caught by eating COVID-19, but at the beginning, right, we were still learning. There are still a lot of unanswered questions. So Uncle Charlie, I think it's good to not let your guard down. I think that's the message that you're trying to tell everybody is that, hey, if you got COVID and you recovered, keep your hands up and your chin down. If you got your vaccination, keep your guard up. Don't be reckless because there's still a chance, less of a chance, but still, who wants to risk it, right?
I mean, you're both exactly right. The vaccine is a really, really strong level of protection. And I do want people to understand that because these vaccines are much more effective than many vaccines that we use all the time. They're very highly effective, but they are not 100%. Very few things in life are 100%. I didn't know, Mayor, that you thought that you were concerned about COVID and poke. I thought you just didn't like poke.
No, I love it. I was dying. I was like, oh.
But I think a little bit of continued concern is absolutely appropriate. And, when we lifted the outdoor mask mandate, the Department of Health said, but we still recommend masking if you are in a crowded place, even if it's outdoors, because you don't know who around you is unvaccinated and may be shedding the virus, and you could still become infected. So it certainly makes sense to still be careful, to still, be careful in crowds or avoid crowds, wear a mask when you're around a lot of people, follow the existing indoor mask mandate that we have in our state because we're continuing to be cautious. But you can eat your poke and you should eat your vegetables.
Oh, I totally know now. And I was just saying, like, at the beginning, it was sort of like, you remember I was bugging you? Like, does this virus die in the ocean, right?
Yeah, I remember the ocean. Oh my God.
We couldn't get a definitive answer, right? Like at the
I found it for you.
Huh?
I did find the answer for you eventually. I remember sending the article.
Yeah, but for me, I was getting a lot of vitamin C, right? Surfing every morning because that was what was keeping me level-headed and on an even keel. But at the very beginning, we couldn't get a definitive answer. And I was like, well, what's so hard? Can't we just get the virus, put it in the ocean water and just see if it dies? But everybody was so focused on vaccine development, getting testing. Remember now, testing, it took a while for them to develop a good test that was very effective. So at the very beginning, my God, it was like, it's just, I can laugh at it now because we know so much more now.
Right, right.
Yeah, I remember he was on our show talking about surfing and being concerned about the spray going and passing COVID. I remember that vividly. Sarah Blaine said, OMG, what the mayor means to say is, quote, eat your vegetables, people,
Oh
unquote.
yeah, totally. Eat them up, you know. Support your local farmer. Um, e- Eat all the vegetables you can. It does a body good.
You know, folks, I'm going to say it right here. I totally agree because who used to love Supreme Pizza, would spend 45 minutes taking every single bit of vegetable off that pizza. And my wife said, you know, honey, why didn't you just buy a pepperoni pizza? Then you would have saved the time.
But then it wouldn't be a supreme.
Yeah, would it be a Supreme?
I think bottom line is, Dr. Berreman, the vaccine does not create total immunity. I don't know vaccine does. And I think that's the message that gets misconstrued because it is talked about every morning on the news. And the lieutenant governor makes it very clear that you're total immunity, and it's not. And I think that's what gives people a false sense of security. And we preach on our show, do not let your guard down. I mean, the mask has become a habit now. It's kind of bizarre. It's like we're outdoors. I'm by myself and I still wear my mask because it's just become a habit, and we just want to do the right thing. Interesting story tonight on the news about the blood banks, that they are in dire need of blood, because it was interesting because they asked them why all of a sudden, how come we cannot keep up? They said because of the pandemic, many of our non-COVID patients put off their treatments and their procedures because of the COVID pandemic, and they're all coming in now to get it done. And in fact, they're using more blood because they waited and their conditions worsened and they cannot keep up. So I just wanted to plug that in because, guys, if you can, please go donate. I mean, there is an extreme shortage of blood. So I just wanted to put that PSA in. We got about a couple minutes left. I just wanted to give you guys an opportunity to maybe share about vaccines. Where can people get vaccines? Things change so much. If you're on Kauai, what's the best way to get a vaccine? Either one of you.
Best way to get a vaccine is in your arm. um,
Oh,
Oh,
okay.
I'm
See,
rubbing off of the doctor with her little sense of humor and her yucks right there,
sorry.
huh?
You can get it at any of our hospitals. You can get it at many of our pharmacies. You can get it at clinics, Ho'ololahui clinics, Kaiser clinics, the VA clinic. Many of those places accept walk-ins. Actually, most of them do. I just saw a sign that Walmart accepts walk-ins. So it's really every place you go. It's easy to get once you want. And if you want the details, they are at kauai.gov/vaccine. May I make a tiny PSA?
please.
The county has 3 beautiful clinical vans that were donated by a very generous donor. And we are poised to make 2 of those into vaccination vans and 1 of those into a free testing van and take them all over our island. And we are recruiting to hire full-time staff to work on those vans. And we, like other employers, are having a very hard time finding people. So if anybody is interested in helping to bring vaccines and testing all over our island, please go to kauai.gov/vaccine and look into sending in an application for a job to work on one of those vans. That's my PSA. Thank you.
I just saw that.
Wow.
$22 an hour, guys, to drive that van and help people. Come on. I just saw that. It was awesome. Much mahalo to the donors of those vans. Mayor, any closing comments, my friend?
No, I think that was a great PSA. You know, we have a good resource, and it's really now at this leg of trying to push the needle to get more people vaccinated. There is a segment of our population where those vans are going to be very handy to be able to get to, you know, harder to reach communities, certain demographics, and it's a resource that we'd like to see get to best use. But it's meaningful to be actively deployed in the COVID-19 response. And let me tell you, there is a tremendous sense of purpose. So if anybody is looking, I think even as a summer hire job, I don't know what the age requirements are, Dr. B, but many moons from now, when we look back at this situation and the grandkids ask, where were you during this great pandemic of recent times, you'll be able to say that you had an opportunity to work the front line and get vaccines out and be a part of that disease prevention that really brought us to the next level, kept this island safe. So please, if you're looking for meaningful work, reach out to Dr. Berreman. They have positions open, and I can tell you it's very rewarding to be actively deployed in this COVID-19 response.
I almost feel like we got to do a Facebook Live in that van one day when you guys do your island-wide thing.
I'm going to be a driver,
I'm thinking about, I've volunteered to drive. I also saw they need vaccinators.
I cannot. So you cannot. Because if I cannot, I don't know. It's easy. I mean, you just
I think so.
On somebody, but you gotta be. I asked Dr. B, and she just said you gotta be licensed. I get it, but I'll drive the van.
It's harder to learn to drive a van than it is to poke somebody in the arm. The only problem, I would probably pass out. I would probably pass out before the needle went in that person's arm.
So Mel, you can be the driver and the registration person, and I'll give the vaccines. Okay, if we can't hire anybody, we'll just do it on a volunteer basis.
I think we need to do that just to go out and get the word out, like the ice cream truck. The ice cream truck or the Manapool wagon.
We're gonna be playing ice cream music on that thing.
Yeah.
No, but you know what? We don't want kids running out thinking they're getting ice cream and having a whole bunch of angry parents, right? Like, what are you guys doing?
I tell you what, Mel and Charlie will donate ice cream. So everyone that comes and gets a shot, you of course you can be entered into the state's contest, but you get a free ice cream from Mel and Charlie. How's that?
That'd be awesome. I'd get a second vaccine just to get the ice cream.
My wife had just sneaked in. She just made some chocolate chip cookies.
That looks delicious.
It's hot, Charlie. It's like hot.
Oh, that's not fair.
No, Mayor, you know you're gonna get. Mayor, you know you're gonna get tomorrow. She always makes for the mayor. Whenever you guys come, I don't know if they're giving it to you, Dr. Berreman, but are you getting it?
Oh, no? Absolutely.
Well, no, he's not sharing with me.
Yeah. Oh, yeah. And I tell you, the whole team is getting it, right? Okay. So, Patsy, thank you, because I tell you what, food lifts the spirits. You know what I mean?
Absolutely.
Like comfort food, it lifts the spirits, and so keep it coming.
My spirits are through the roof already because this thing is so delicious. Oh my God, Charlie.
Well, I'd like to say thank you to our mayor, Dr. Berreman. Thank you so much for joining us tonight. Mayor, comment from the beautiful Angela Keene. If Mayor considers running for governor, I have a couple thousand couple breaker group members who will support him. That's a vote of confidence. So that's from our lovely Angela Keene. I did want to say a special shout out to the frontline workers, all the medical staff that has been putting vaccine into arms, all the staff, the support staff that it takes to roll out a vaccine program, and to the many who have gotten the word out and the importance of why we all should be vaccinated. I just want to send a special shout out and thank you to all of you, because it's not easy. And with everything on, all of you professionals, you stood your ground and you did what you had to do to get that that vaccine into people's arms. And I just wanted to give a thank you, because I know I thanked you when I got my vaccination, but then I know some of the unsung heroes went without a thank you. But I just wanted to make sure that on tonight's show, we gave you that. So thank you very much. Now, yes, Mayor.
And sorry to add on, but I'd be remiss if I didn't take this opportunity to thank our our airport crew out there. I know on the 15th we winded down on that operation, and I can tell you, we had a police department that was fully engaged from day one, and we had a National Guard presence. We had fire. We had the planning department. There were so many people that really kept this island safe. But I do want to give a shout out to our National Guard. You know, it's the National Guard is great. You know, from a mayor's perspective, it's like the best thing you can have. It's an easy button to push, but it comes with a big price tag. And you know, the National Guard is going to be winding down their presence. And these are hundreds of young, right, young men and women who are not even from Kauai, right? Like these are young people who missed out on their own baby's birth, their own kids' birthday parties, school graduations. They miss funerals, they miss everything. But they fully went all out for an island that, you know what I mean, they're not even from, but they have a deep connection to. And, you know, to anybody out there in the National Guard and to all of our military, active and retired, I just want to say thank you, because they're going to be deeply missed. They built bonds with the people of Kauai. They will always be Ohana. And I know that as they start to wind down and depart, it's going to leave a big gaping hole in the heart of Kauai and in many, many people's hearts. So I want to thank our National Guard for just being engaged, and big mahalo to Task Force Kauai.
You got to unmute now. Unmute. You got to unmute.
You know, Charlie and I had the benefit of meeting a bunch of doctors from across the country. In fact, across the world. We even had Dr. Kim from South Korea, but we had Dr. Murtaza, we had Dr. Kimball, we had other doctors from different places on the mainland early on that had witnessed so much death, COVID death. And they would go home and wash up and they'd be on our show. And we could tell the emotions that they went through, the frustrations, because back then we just didn't know much about this virus, as you said, Mayor. And we've come a long way, but and I bring that up because those healthcare professionals, those frontline people are still there, still doing the deed. Yes, we've come a long way, but they're still seeing death. They're still seeing sickness. And when I heard the guy talk about the doctor today, talk about the need for blood, it just struck me hard. Like, wow. I mean, how do you continue to do your job every single day when such a vital part of your job, blood, is not available? How do you? It's just so. I bring that up because I just want to echo what Charlie said about our frontline medical personnel and everyone in the field, as well as our National Guard. There, Mayor, I saw one of them today at the station. Man, he doesn't want to leave. They were here. It became a lifestyle for them. They were there every day doing what they need to do. And, you know, I want to say this because a lot of people were arrested for quarantine violations on Kauai. It doesn't get publicized. And I know a lot of people see the National Guard guys all around, driving around. But I just want to say this, that they did their job and they never get recognized. So thank you for bringing that up as well as the KPD officers. I saw Officer Thompson today. You know, they took that seriously. And we want to thank them all. And again, thank the two of you for being here. We appreciate you guys so much. We'll have the cookies there tomorrow morning for you folks. And of course, Sarah Blaine, who's on answering questions as she always does. Sarah, thank you. You're the best. You guys all have a wonderful evening. Stay safe. God bless you guys. Again, take care. We'll see you guys on Friday night.
Thank you.
Aloha.
Bye.
Aloha.
Hey.